to swear you in.
Terrific. Well, as is customary, I'm joined by terrific members of our team in the Attorney General's office, who you'll hear from in just a little bit. But I want to thank you for that kind introduction, Dr. Altman, and I want to thank everybody here on the Commission for all the time and energy and considerable effort that you put into this really important endeavor. And we are here in a spirit of partnership and collaboration as we all collectively work together to do all that needs to be done in this space. So I want to thank you for the opportunity to appear before you here this morning with the team. Thank you, Auditor Bump, for your comments as well, and we certainly enjoy working with you and the partnership we have between our offices. Secretary Sutters, who is working so hard on so many fronts, thank you for all that you're doing day in and day out across so many different important sectors. Vitally important sectors, and we know that takes considerable time and effort. Secretary Lepore, Executive Director David Seltz, Aaron Boros at HPC and SHIA, thank you all for coordinating and hosting these hearings. So, and I want to say a special hello to the appointees of the Attorney General's office. It's great to be with all of you this morning. Thank you for your service. Look, I know that we have a lot to be proud of here in Massachusetts. I travel to Washington sometimes and other parts of the country, and especially on a topic as challenging and complex as healthcare, I am so proud to be from and of Massachusetts, which time and time again has shown the country that it is open, innovative, and responsive. We were the first state to bring universal health care reform to its residents. We benefit from a legislature that is extraordinarily diligent and fluent in complicated health care concerns that touch on cost, quality, and access. Our providers and insurers are among the finest in the country and have been part of generating solutions from day one. New agencies, such as the Health Policy Commission and CHIA, are devoted to tackling the important problem of cost containment. Look, together we have a shared commitment, I truly believe that, to addressing the burden of healthcare costs on consumers and businesses across the state. It is in that spirit of openness and responsiveness that I'd like to share a few ideas on where we can and where I believe we must be doing more to improve the affordability and accessibility of healthcare services in the Commonwealth. This is part of an ongoing dialogue, and you'll hear more from my terrific team shortly about some of the specific work we're doing in these areas. What I want to share with you now are a few guiding principles that help us and have helped us frame our understanding about the problems in healthcare. First, I want to speak to healthcare affordability. Healthcare affordability is ultimately about accessibility. The two go hand in hand. If healthcare is not affordable, it is not accessible and is not there to do the good that it is supposed to do. A setback in affordability is a setback in sustainable access for consumers. We want people to have meaningful access to care, and we don't want businesses or their employees to go bankrupt trying to get it. We know that when employers spend more on health care, they have less to invest in their business, less to invest in workers. We know that with high health care costs, people have been subjected to terribly difficult decisions, decisions one shouldn't have to make. The choice between seeking needed care and paying a high deductible, or making a month's rent, or a car payment, or clothes for their kids. These are not decisions we want people, especially people here in Massachusetts, to make. I know that, you know that, and that's what today is about. Some of us probably saw a recent article in the paper that highlighted a story that we hear commonly, a woman who decided to forego an MRI. She had a history of brain tumors because of her increased deductible. That's why we're here. We need to monitor access, and we need to monitor measures of access in the same way we monitor measures of cost. The two really do go hand in hand. The second principle I'd like to talk about is averages. Averages are important. We hear a lot about averages. But I think what's really important is that we dig into those averages and we get underneath those averages and we look at what that distribution reveals. Digging into averages is something that our office has done and will continue to do in an effort to identify areas where there are disparities, where there are inequities that need addressing. Averages are really important and they let us know how we're doing overall, but it's the underlying distribution that really tells us how specific groups are doing and how their experiences contribute to and shape the average. And I'll just give you a particular example. We know that insurance coverage in Massachusetts is approximately 96%, but reports indicate that in certain parts of the state we're not doing as well. Places like Everett and Lawrence are under 90%. And that's what I mean when I say it's important not just to look at the average, but to look at the distribution. We know that overall premiums have been rising more slowly. That's good. For example, in 2013 and 2014, commercial health care spending in Massachusetts grew by 1.2% and 2.9%. But for the merged market, our small businesses and individual consumers, premiums are set to grow by 6.3% next year. That's a problem. It's our small businesses and individual consumers who tend to have the least financial cushion and ability to absorb spikes in costs. And we know that the prices paid to providers are increasing more slowly than in past years, which is a good thing. But underneath that average, some providers are still getting twice the rate increases as others. Again, it's important to look underneath the numbers. That, of course, only perpetuates the rate inequalities that ultimately escalate costs and that this commission has set out to address. Those rate inequalities result in disparate levels of resources to care for patients affiliated with different provider organizations. You'll hear in more detail from my staff regarding the work we're doing to get underneath some of those averages and what we think the dynamics and distribution underlying those averages mean for healthcare cost growth. We also raised some suggestions for how we might consider expanding efforts to address problems. And I want to say on behalf of all of us in the Attorney General's office, we look forward to listening, to learning, to working with you, the legislature, market participants, stakeholders, sister agencies, to improve our collective efforts to achieve a more affordable, accessible, and equitable healthcare system. At this time, I'd like to turn it over to our team for a presentation. I also want to just acknowledge the work of Martha Coakley for her foresight in establishing the healthcare division so many years ago when she took office. And the team under her watch did tremendous work, I know, over many years in preparing reports, providing data. It's something we can do, and providing information for policymakers. And so it's a credit to Martha Coakley that I'm here, and we will continue in that effort and in that spirit in the time ahead. At this time, I'd like to turn it over to Assistant Attorney General Courtney Aladro to present on behalf of our office. Courtney is no stranger to this group. Joining Courtney from our healthcare division this morning are Emily Gabreau, Robert Sixia, Tara Ruddle, and Bella Gorman.